The other day I posted something regarding congestive heart failure and someone was asking for some more information. So I'm going to talk a little bit more about it, because sometimes we hear heart failure and we don't really understand exactly what it is. Because one big myth is that heart failure means that your heart actually stop, and that is not it. It means that your heart is not pumping blood as strongly as it's supposed to be, or as effectively as it should. So when you hear congestive heart failure, just think of it that your heart is a pump. Its job is basically to push blood filled with oxygen and nutrients to the rest of the body. So when your heart becomes weak and it becomes stiff, it can't pump that blood properly. So what happens is that blood, it starts backing up, and when that blood backs up, it fills up into the body, right? And that's why we say congestive heart failure, because of that congestion, meaning the fluid buildup. So I hope that is a little bit clear. So it's not your heart just stop. Some of the most common causes for congestive heart failure is because you might have long-term high blood pressure or uncontrolled high blood pressure, previous heart attack, you might be diabetic, you might have heart valvular problems, obesity, chronic alcohol use. Over time, what these problems does is that they strain the heart and weaken it. So a lot of times these persons tend to be short of breath, especially when they're lying down and they're walking. They might have swelling in the legs, their ankles, their feet. They might have sudden weight gain, like over a few days, they might just, get a lot of weight on. They might be feeling tired, they wake up at night, gasping for air, or they might be needing extra pillows to sleep on. So sometimes you might hear us ask, how many pillows do you sleep on? That is to find out if you're having a heart failure. That sudden weight gain is usually because you have fluid buildup and it's not related to weight, fat. You understand? So if you've gained like anywhere like 2 to 3 pounds overnight or 5 pounds in a week, usually that's a red flag for us. When you think of left-sided heart failure, we're thinking that your heart is struggling. You have fluid that is built up in the lungs, causing breathing problems. When we think of right-sided heart failure, it backs up into the body, causing swelling in the legs and in the abdomen. So yes, heart failure is something that is serious, but it's very important that if you manage it correctly, we can actually control the symptoms and you can actually live for years. But you have to control your symptoms. So the treatment usually includes like your medications to help with your heart, you understand, so you can actually pump better. You have diuretics, also called the water pills, that a lot of people don't want to take because of the extra fluid that it's pulling and causing them to urinate. The low sodium diet, yes, we don't want you to cut down on your salt intake. We want you to limit your fluid intake as well. And we want you to monitor your weight. Regular follow-up is very important with your doctor. Lifestyle changes are very, very important, and that will make a huge difference in your overall prognosis. It's very, very important to take care of your heart from early. Control your blood pressure, control your sugar levels, control your weight. Stay active, and once you're able to do that, if you notice any symptoms from early, do not ignore them, because the earlier you take action, that will save your life. I do hope that this little information will help you understand. I know one person was asking for some more information. I hope this information does help, but do go ahead and share this information with a friend or two. Have them come over and be a part of the channel. And if you want to hear more information like this, just put in the comment box below more, and I will go ahead and create short, simple information to meet your needs. Until then, I will see you in the next video. Bye.